Hi, I'm Dr. Mukesh Gupta, obstetrician and gynecologist from Lenest, Malad, Mumbai. Postpartum hemorrhage or PPH is a situation which can cause a lot of trouble and pain to a woman and her family because of its associated risks and complications. Well, today we're going to discuss top 10 issues that we need to know about PPH when a woman is pregnant and when she delivers a baby. So first of all, what is PPH? That's our first issue. Well, postpartum hemorrhage is a situation when the bleeding which happens after the delivery is more than what we would have expected it to be. Especially it may be more than say around 500 ml, and it is having an impact on the health of the mother, meaning her blood pressure may start falling, her blood pulse rate may start rising, or she may start getting a lot of symptoms. That is postpartum hemorrhage. How bad is it? How big an impact it is? Well, almost let's put it this way, if there are 100 women who are going to die because of pregnancy related complication, almost 25% of them in some countries, and in some places as high as 50 to 60% of women die because of PPH. It is so dangerous. Not only is it dangerous from the perspective of death of the woman, but also it is dangerous from the perspective of the long-term impact. So what are the long-term impacts that happen after delivery and PPH? The hemoglobin starts falling. The woman's general well-being is bad. Her healing of the stitches, if it is an episiotomy or if it is a cesarean section, is going to take a lot of more time than what we would expect. It also affects the woman's ability to handle the baby post-delivery. Even small things like feeding the baby, diapering, changing, and doing all those things for the mother becomes very difficult because she's very tired, fatigued, and because of the low hemoglobin, it can have a lot of other issues with her psychological and emotional well-being. The next important thing that comes on our mind is who are at risk. A woman who is planning for a baby, if she's having low hemoglobin, or if during the journey of pregnancy hemoglobin has been low, or if she's got more than one baby, as in twin pregnancy, if she's got a complicated pregnancy as in preeclampsia or raised blood pressure or large size baby, or if she is having situations like abnormal placentation, the placenta is on the lower side of the uterus, or it has been abruptly separated, we call it abruptio placenta. Sometimes there can be a generic condition, general issues which can affect her more, her immunity more, and high chances of infections, and all those factors can also lead to risk of PPH. Then comes another set of issues at the time of labor or delivery. What goes wrong at the time of labor that can lead to PPH? Well, if there's a prolonged labor or an obstructed labor or multiple gestation and twin pregnancy normal delivery, or it can be because of raised blood pressure. It can be some issues where the placenta is not completely coming out and part of it is retained inside, and that may cause a problem. So this is the fourth important issue that we need to know. Lastly, fifth important issue that we also need to understand is what may be the precise cause of this PPH. So in medical fraternity, we say it can be tissue, it can be thrombin, or the commoner ones, that is trauma, and the most common one, that is tone. Meaning, the tone of the uterus is so less. Normally after the uterus getting, baby coming out, the uterus has to contract and retract. But it just does not happen. It's supposed to, kind of squeeze the blood vessels which are there so that the bleeding stops. But it just doesn't happen. And that is one of the commonest reasons for PPH. We call it atonic PPH. Next is trauma. During the journey of the baby coming out of the birth canal, it can lead to a situation where there can be a tear in the cervix or the vagina or the episiotomy, or at the time of cesarean section, there can be bleeding happening from injuries, and that is called as trauma. Next is thrombin. Well, preeclampsia is a major concern where the blood pressure is high during the journey of pregnancy. We have a separate video on that, hypertensive disorders in pregnancy. Please watch that. You can actually land up with increased bleeding at that time, and that's again a concern. Then there is something called as tissue, the retained bit of placenta, or retained bit of, or it can be the whole placenta which is not coming out. It can be an abnormal placenta, what we call as placenta accreta or increta or percreta, depending on how much the placenta has stuck to the uterus, and it can cause bleeding. So these are the various reasons for which the bleeding can happen. And then if we look at that, Then comes the treatment option. So let me talk about the treatment options that you need to know about when we are planning to, when we land up with the situation. Because once we understand how it can be treated, it becomes easy for us to plan for the hospital and plan for the, preventive measures. So that's the most important tip that I would like to say, the sixth tip, that is, what is the treatment for varices? It definitely depends on what is the cause of PPH. So for example, if the tone is not good, then what we have is a standard protocol. In fact, not just the disease, we also preemptively try to prevent it by having active management of third stage of labor, where we give medications which will cause contraction of the uterus and reduce the bleeding. So it can be an oxytocin, it can be a carbetocin, it can be a prostaglandin, it can be a methylargometrin, depending on various different situations and predisposing factors. We have to choose and pick what can be given, what cannot be given. Here is an important tip. You need to tell your doctor if you're suffering from problems like hypertension or asthma, because the drugs which are used at this time, at the time of delivery, have an impact on your body, especially if you're suffering from this. For example, we cannot give a prostaglandins if you have an asthmatic history. So we have to be careful while giving it. Or if your blood pressure is very high, we have to be careful while giving a methylargometrin injection. So these are the small things that we have to be aware about at that moment of time. If there is an injury or trauma, then we need to repair it surgically, take stitches and hemostatic sutures to prevent it. If there is a retained placenta, we do a procedure called manual removal placenta, where we remove the placenta. It can be done under anesthesia. Or if there is a preeclampsia, then we need to actually plan and arrange for things for treatment as per the situation of the patient and try to help the patient out. So that is how we manage that. Now the seventh tip is, what can you do about it? What can you as a patient do to prevent this risk or reduce this risk? Well, it starts not just during the journey of pregnancy, but even before that. When you plan a baby, you need to have a preconceptional visit with your doctor. We have a whole video on preconceptional planning. Please go to our channel Lennes, and if you have not already subscribed it, kindly subscribe it and go to the playlist and check for these videos. In fact, this video is also in the playlist where role of partners in pregnancy, where we talked about the role of both the husband and wife on preconceptional planning. So even before you plan a baby, you need to actually plan to stay healthy and stay fit during the journey. So if your hemoglobin is good, very good. If not, and if it is low, then we need to investigate you right away to look for any abnormal types of hemoglobin or any reason why it is happening, any chronic disease or inflammation which is causing it. Say for example, if you are having a trait of Thal minor, your hemoglobin is always going to be low, but then we need to do some investigation for your partner as well, so that you don't have a risk of landing up with problem in the baby. We have a separate video on Thalassemia minor. Please watch that. We have explained all those things in that. So the first step is before pregnancy. Then second step is during the journey of pregnancy. So that's the eighth step. So at the time of pregnancy, what are the things that you're going to take care so that you don't land up with a problem? Say your doctor has advised you for iron supplements, take it sincerely. Don't goof up. If you don't take your irons properly, then it's going to be a big mess. Number two, if you have a high risk factor which your doctor has identified, as in twin pregnancy or as in high blood pressure or as in multiple previous pregnancies or past history of having PPH, all those factors, if the doctor has identified, they may tell you that you need to be careful about this, and we need to be a little more careful at the time of delivery to prevent this infection or to prevent this complication. The next tip, that is one of the most important tip, is the ninth tip. How do you choose a setup when you have such high risk situation? Well, most of the hospitals are equipped to take care of your complicated situation. So I always talk about, I have done a lot of these workshops on technical and non-technical skills for handling PPH, meaning the knowledge of the science and the surgeries that are required to handle the PPH, which includes medications and sequential surgical steps that will help us to reduce the bleeding, or we may have to take some surgical intervention. And along with that, the non-technical skills, where we have to have the situation under control, that is situation awareness, communication skills, leadership skills, and most important thing, decision making skills to plan out how to handle an emergency. And for that, we have some standard protocols, and we do these mock drills in our kind of setup where we're trying to prevent that. Most good setups have these protocols in place. This helps to reduce the risk of PPH. Also, access to a good doctor with a good surgical experience and availability of blood in case of complication and emergency is another very important thing that you have to look for. So these are the things which are very, very important, and immediate decision making, where the family members are aware that if the complication happens, action has to be taken immediately. So there has to be a kind of a person in charge who is going to be there in case of crisis to take those decisions. So this is the ninth tip. last but not the least, the most important tip is that what future impact can this have in your life? Well, like any other complications, it is going to have some impact on your life. When the PPH happens and if there is a bleeding, then there is a chance in next pregnancy also you may have that. Once you have landed up with bleeding, the hemoglobin is lost, so we may have to cover it up, compensate it. If it is not much, then we may give you injectable iron therapy, or if it is high, we may have to give you some blood. And following which, if we do not correct this anemia, then it can have impact on your post-delivery phase, that is higher chance of postpartum blues, higher chances of fatigability and irritability and not being able to handle the baby and all those factors. But let me put it very simply. Postpartum hemorrhage has been a major concern for complications for all of us in healthcare setup when it comes to women's care. But at the same time, we really work hard to create systems and protocols to reduce this and cut down on the risks that are happening when a woman delivers. And in our journey for that, we do a lot of these training programs and a lot of these workshops for our team as well as fellow colleagues, and we have these task force around us who help each other whenever the situation happens. So don't be scared, talk to your doctor, allay your anxiety, but beware, if you don't take charge of your health and if you don't take care of your hemoglobin and iron supplements, etc., you may land up with this complication. Thank you very much. Stay healthy, stay fit.